Good afternoon. The month of June is the Dengue Awareness Month. So we will be having a lecture on how dengue spreads, its disease, and the ways to prevent from being sick of dengue, especially na dumadami na rin yung cases. And we are in the rainy seasons na din. So aside from that, we will be also touching later the monkey virus, which has also been a health threat globally. So without further ado, let's start. So dengue goes by other names including the breakbone fever and dandy fever. So dengue is an all year round disease in the Philippines. In 2008, the Philippines was reported as one of the countries with the highest number of dengue cases and deaths in the Western Pacific region. In 2018, there were about 216,190 cases of dengue and 1,083 deaths were tallied. In 2019, there was an increase of cases to 437,563 cases, and among which there were about 1,689 deaths. So medyo tumaas siya. But in 2020 to 2021, the cases were a lot lesser. This is actually highly attributed to the COVID-19 pandemic. So the dengue is actually the fastest spreading vector-borne disease in the world. And it has 4 serotypes. So kagaya ng COVID-19, yung dengue may serotypes din. So we have the dengue1, dengue2, dengue3, and dengue4. So the first infection with one of the 4 serotype usually is non-severe or asymptomatic. Wala siyang symptoms. While the second infection with one of the other serotypes may cause dengue severe. So dengue has no treatment, sadly, but the disease can be early managed. So dengue can be transmitted through a bite of a dengue mosquito or the Aedes aegypti mosquito and the Aedes albopictus mosquitoes. So these mosquitoes, sila yung nagkikarry ng virus. And they can lay eggs in any space or container that holds clear and stagnant water, like a bottle cup or dish dryer, or it could be sa gutter or rubber tire. So they usually bite between 2 hours after sunrise and 2 hours before sunset. And this mosquito also spread the chikungunya virus and Zika virus during the day and night. Paano ba ito nagtra-transmit? So, it can be transmitted through an infected mosquito that bites a dengue-infected person. So, once na-bite na yung infected person, that mosquito will carry the virus for the rest of its life. And that infected mosquito will bite a person, so natatransmit niya yung virus to that person. So that is how dengue is transmitted. So the infection of dengue is actually systemic and dynamic disease with a clinical spectrum that includes both severe and non-severe manifestations. So after the incubation period of 3 to 14 days, so the illness begins abruptly and is followed by 3 phases. So the first phase is the febrile stage, so nilalagnat, critical stage, and the recovery phase. So what happens in febrile phase? Usually, this is actually 2 to 7 days na period, and it is accompanied by general body medley, body aches, muscles, and joint pains. There will be retroorbital pain and facial flushing. So, aside from that, some patients also nagkakaroon ng sore throat and hyperemic pharynx. And there's a petechial rash. Namumula yung balat nila na parang may rash na flat siya. Hindi siya makate. So, that is what we call petechial rash. So, sa ER, minsan, if there's a coming patient with those rash, so tinitest namin what we call the tourniquet test. So, in the lower arm, nilalagyan namin ng elastic bandage, and then hinihigpitan for about one minute. And then if there will be more than 10 petechiae, or yung puntok-puntok na pula in a 1-inch box, then that's what we call a positive tourniquet test. So this is actually a diagnostic test. I mean, that's a test that could be helpful in the diagnosis of dengue. So in the second phase, which happens usually 3 to 7 days of illness, so what happens in the critical stage, nagkakaroon ng warning signs, and it may progress to severe dengue. So what happens in patients with warning signs? They can have persistent vomiting, severe abdominal pain, mucosal bleeding, so epistaxis, or dumudugo yung ilong, tsaka yung iba dumudugo yung gums. There will be difficulty breathing and early signs of shock. So that's why tinitingnan yung BP ng pasyente. And also, there's a progressive leukopenia followed by a rapid decrease in platelet count. So, aside from that, sa this phase also, may iba na walang warning signs. And some of these patients ay nagkakaroon ng walang symptoms. So, some of them proceeds to recovery immediately. But, if hindi naman ganun yung nangyayari, so some of the patients nagkakaroon ng severe manifestations like pleural effusions, or nagkakaroon na ng tubig yung baga, hypovolemic shock, severe hemorrhage, and organ impairment. So that's what we call severe dengue. So, nagkakaroon din ng severe hepatitis, naapektuhan yung ulo, what we call encephalitis, and yung heart, myocarditis, so namabaga yung heart. So this is an example of a X-ray with pleural effusion. So yung sa right side na medyo maputi. So that's actually too big. So that's a sign of pleural effusion. And this one is a picture of an example of hemorrhagic rash. So this is an example of a CBC count. So aside from platelet, tinitingnan din natin yung importante actually yung hematocrit. So in this example, normal naman yung hematocrit niya. So tinitingnan sa dengue if nag-i-increase if there's an increase in hematocrit. Kasi ibig sabihin nun, the patient is so dehydrated. So, pwede siyang mag-progress into shock. So, sa recovery, which happens 48 to 72 hours, there will be improved well-being, hemodynamic status stability happens, and also the hematocrit stabilizes. The patient will be able to urinate. So, ibig sabihin, okay na yung hydration ng pasyente. So, and also in recovery, there's what we call the Isles of White in the Sea of Red. So, ito yung characteristic rash din na there's puntik-puntik na puti aside sa red na rash. So, it's actually a sign na the patient is recovering. So, aside from that, we have to know the critical problems sa dengue in different stages. Kasi ito yung so that we will hindi siya magpa-progress into a more severe phase. So, sa dengue, tinitingnan natin, in first phase, tinitingnan natin if okay yung hydration ng pasyente. If there's a high fever, then we give paracetamol so that some of those kids will have febrile seizures. So, dapat i-prevent natin yon. And watch for neurologic disturbances. If yung bata tulog na lang tulog, irritable. So, those are the things that we need to know during febrile phase. Sa critical stage naman, we have to know and to be watchful for signs of shock, severe hemorrhage, and organ impairment. Sa recovery, akala natin okay na, recovered na. Pero, dapat i-watch natin dito if nag-overhydrate na tayo. So, excessive IV fluids. So, monitor natin na if okay na ba yung hydration ng pasyente, hindi natin na-overhydrate. So, this is actually the dengue illness progress table. So, makikita nyo sa upper area, the days of illness, and sa lower naman, the stages of illness. So, during febrile stage, makikita niyo na mataas yung viral load. And the temperature is also increasing. In critical stage, yung hematocrit tumataas, yung platelet bumababa, and also mapapansin yun, temperature sa critical stage bumababa na rin. So, akala natin yung pasyente okay na kasi wala nang lagnat. Pero actually, ito yung critical na time. So, dapat minomonitor pa din natin yung CBC ng pasyente. So, for the treatment, so we categorize patient into group A. So, sila yung patient who may be sent at home. So, ito yung dapat okay lang na i-manage sa bahay. So, sila yung able to tolerate adequate volumes of oral fluids. So, okay lang sa kanila uminom. Hindi sila sumusuka. So, aside from that, they can urinate at least once every 6 hours. They do not have warning signs. They are ambulatory and has stable hematocrit. So, what we do in our house, so we do, encourage natin the patient to do bed rest, to drink plenty of water, and patient may also drink milk and fruit juices, and also plain water. So, but we have also to advise them not to drink or eat dark-colored foods. Kasi, kasi pag tumae sila, may mga pagkain kasi na nagiging dark din paglabas. or yung tayo nagda-darken. So, this is actually a dark stool is actually an indicative of a internal hemorrhage. So, ayaw natin na ma-misdiagnose yung pasyente. So, we do not encourage it na kumain ng mga dark colored foods. So, also in our home, we take paracetamol if nagfi-fever, can do tepid sponging, and also look for mosquito breedings in places in and out the home and eliminate them. So ito yung mga sports drinks. Actually, hindi in-encourage na uminom ng sports drink kasi ito yung mga drinks na matataas yung sugar content. So actually, ginagamit to ng mga athletes for them to have more energy during um, high energy sports. So high energy requiring sports. So what happens if ininom to ng mga pasyente, they become more dehydrated kasi nga mataas yung sugar content. So aside from that, tawa-tawa, so has been a study na mataas yung bioactive compounds like phenolics and flavonoids ng tawa-tawa. And it was studied by the DOST and the Philippine Council of Health Research and Development. So, according sa pag-aaral nila, may effective daw yung tawa-tawa for dengue as a supplement. So this capsule is FDA approved, but it claims no therapeutic properties. So, hindi siya treatment. Ito lang ay parang supplement. So, it has been found also na may anti-thrombocytopenic properties yung tawa-tawa. So, pinapataas niya yung platelet count. So, aside from that, we have the Group B patient. So, sila yung patient who should be referred for in-hospital management. So, sila yung dapat i-admit. So, i-admit yung patient with warning signs, patients with coexisting conditions such as pregnancy, infancy, old age, obesity, uncontrolled diabetes, and renal failure, and so on. So, aside from that, ina-admit din yung mga pasyente with social circumstances such as living alone, live from far-flung area, or yung without a reliable means of transportation. So, ina-admit din yun for monitoring. And aside from that, the Group C patients, sila yung mga patient with severe dengue. So, most of these patients, sila yung ina-admit sa ICU. So, they require emergency treatment and urgent referral. So, again, yung dengue has without warning signs, with warning signs, at severe dengue. So, ito yung tatlong categories ng dengue. So, for the diagnostic test, meron tayo nito dengue NS1 rapid test. So, it's actually requested on the 1st to 5th day of illness. And it can detect virus antigen during early phase of acute dengue infection. So, what's the difficulty lang is this test is not readily available sa hospitals. So, may ibang mga clinics or diagnostic centers, wala silang ganitong test. So, aside from that, meron din dengue IgM and like the IgG test. So, ni-request ito if the fever is or the illness is beyond 5 days and can detect dengue antibodies during the acute late stage of dengue infection. So ito lang sila yung mga beyond 5 days, and aside from that, they give false positive results due to antibodies induced by dengue virus, and also can react with other disease such as chikungunya and Zika virus. So aside from that, we have the PCR, which is the confirmatory laboratory test. So kagaya din ng COVID-19, ang RT-PCR pa rin yung confirmatory test na ginagamit sa dengue. So these are the routinely used laboratory tests, the WBC, platelet, and hematocrit. So sila yung actually readily available sa mga testing centers. So we look for the trend of decreasing WBC, decreasing platelet, and increasing hematocrit. So ito yung mino-monitor natin. So aside from that, so yung DOH had created a strategy para maiwasan at saka ma-prevent natin yung spread ng dengue virus. So the 4S was created against dengue. So the first S is search and destroy. So ito, we throw away, turn over, empty, and store under a roof any container that may accumulate rainwater. Also, we prevent mosquito breeding in areas such as car tires, gutters, and even hollow blocks. So, yun, we put the trash and garbage in a covered container. So that's what we do in search and destroy. So the second S is self-protection measures. So we use screens on doors and windows. Use insecticides such as permethrin and insect repellents such as DEET. So may mga products din na without DEET. So kagaya ng off lotion. Kasi yung DEET is actually a chemical that can be toxic in higher dosage. The third S is seek early consultation. So if you have fever of 2 days or more, so and also skin rash, so dapat magpakonsulta na agad. And the last S is say no to indiscriminate fogging. So actually fogging is done only during outbreaks and does not kill the mosquito, but it's just tinataboy lang niya yung mga lamok. So this is the fogging. So aside from that, the 4 o'clock habit is actually an annual campaign by the DOH, and it's a strategy that mobilizes communities to take time to search and destroy yung possible mosquito breeding places at 4 o'clock, every 4 o'clock p.m. every day. So cleaning before evening is the key to reducing the risk of dengue, as mosquito carrying disease are most active at dusk. So the true prevention is not waiting for the bad things to happen. It's preventing things from happening in the first place. So let's protect our family from this dengue virus and save more life. That's all. Thank you so much for listening.